Hello guys, welcome back to my YouTube channel. This is Miss Henderson. I hope you guys are having an amazing day today. It's such a rainy day outside, so I decided to create some slides with some Prometric CNA test questions. Guys, again, these videos are meant to help you pass your prometric exam, but your job as a student is to still study and read your MOSB CNA textbook. It's just to help you, further facilitate learning. So I just create these videos to help students. Thank you again for those who have been subscribing to my YouTube channel. Thank you so much for your support. Without you, I couldn't really do it. So for my new incoming subscriber, thank you also for giving my video a thumbs up and dropping your comments below. I really appreciate these little things that you are doing. And I hope my videos are providing some form of values to the CNA sisters and brothers out there that is trying to become CNAs. It's a great field to make money. So, if you go to school and you become a CNA, you can always make money with that. They start out with 23, 24 an hour. And as, you get more experience, you can earn more money. So let's look at the first question. So we have a question here states, a resident who is on a toileting schedule asked to use the bathroom frequently. The nurse's aide should respond to the resident request by toileting the resident is not time. You can't say that. No, you cannot. Taking the resident to the bathroom as needed. So the correct answer, I just have two choices, A and B. Normally I have four choices, but today I just did two choices. So you have a better chance of, getting these correct. So, try to do these questions while I'm reading it. Try to come up with your answers on your own because that helps, So taking the resident to the bathroom as needed. That is the correct answer. And this is a Prometric question right here. Question number 2. Which of the following actions helps to prevent skin tears? Now, we know skin tear is a common thing with elderly patient because of their skin is kind of fragile, and they lost that type of skin elasticity due to the collagen decrease in collagen. So is it dressing the resident in a long sleeves, sliding the resident up in bed? No, that is sharing and friction. You don't want to do that. So is dressing the resident in long sleeves? That's the correct answer to prevent skin tears because she has, long sleeves will provide additional protection for the resident. Let's look at question number 3. Question number 3 states, a resident with dementia says, I need to get home. My daughter's school bus is coming soon. The NA, which is the nursing assistant, knows the resident is confused because her only daughter just turned 60. What is the best response by the NA, the nursing assistant? What do you like to do with your daughter when she gets home from school? A or B? Remember, you are in a nursing home. Your daughter just turned 60. So what would the nursing assistant says to the client? So it's basically saying that what do you like to do with your daughter when she gets home from school? That's the correct answer, A as in alpha. Let's look at question number 4. Question number 4 states, a resident has a contracture of the right arm. When putting the resident button front shirt on, the nurse's aide should A. Put the shirt sleeve on the right arm first and then the left arm. Puts the shirt sleeve on the left arm, then the right arm. So we talked about this question in class that oftentimes when a patient has a stroke, a cardiovascular accident, and it depends on what side of the brain is affected. If the right side is affected, then it affects the left side. If the left side, they have a left-sided CVA, a stroke, the right side is affected. And part of our job as a nursing assistant, when you're dressing a patient with stroke and they have contracture and weakness to the right arm, so where are you going to put in? So you have to dress them first. You have to put in the sleeve in the affected or the involved arm, which is the right arm. So A is the correct answer for question number 4. Let's look at question number 5. Question number 5 states, a nurse aide finds a resident who has a history of falls lying on the floor in the resident's room. The resident is crying and says, I fell again. What should the nurse's aide do first? Call for help while keeping the resident calm. Check for injuries while asking how the resident fall. So as a nurse's aide, we spoke a couple of times in class about the scope of practice. As a nurse's aide, we don't check the patients. We don't do a physical head-to-toe assessment. So it's not within our scope of practice. It's to check the resident for injuries and ask the resident how he or she fell. That's the job of an RN. So our job is to call for help, call the charge nurse while keeping the resident calm. So you have to stay with the resident, call for help, and call the charge nurse so the charge nurse can do a head-to-toe assessment of the patient, and then you can get the patient up and put him or her in bed or in a wheelchair. We are doing one more question, and that will be it for this video, guys. Question number 6, a nurse's aide hears the charge nurse screams at a resident. Wow, that's not appropriate. A charge nurse screaming at a resident, that is totally unethical and inappropriate. The nurse's aide goes to the resident to provide immediate protection of the resident. The nurse's aide should also, what do? Reports the situation to the charge nurse supervisor or call the police immediately. Well, we have to follow the chain. We spoke about the chain of command, and we do not call no police or anything like that. If we hear or we witness any type of forms of physical or verbal abuse, because that's obviously the charge nurse is yelling at the patient, that is considered as emotional or verbal abuse. So we will have to report that situation to the nursing supervisor right away. So guys, again, thank you again for tuning in for this short video. It's just a few questions. It's just to help you pass your Prometric exam. If my videos are providing you with any type of values, kindly smash that subscribe button and also the thumbs up, and drop your comments below. Let me know what other videos you would like me to provide you with. Thank you again for tuning in, and bye for now. Catch you in the next video.